Live look this morning at I-70 and 3rd Street near downtown Kansas City, Kansas, one of the many areas targeted by a $500 million federal grant to ensure all Americans have access to COVID-19 resources. We'll hear what is unique about this community and how the grant performed during the pandemic. The morning medical update starts right now. Hey, and good morning, everyone. It is Tuesday, April 5th. Thank you so much for joining us right here on Facebook, on YouTube, and on Twitter. Joining us this morning to talk about the impact the grant is having here in the Metro is Dr. Ed Ellerbeck, Chair of Population Health at KU Medical Center, and also Dr. Catherine Satterwhite, Region 7 Health Administrator for Health and Human Services, and Mariana Ramirez. She is the Director of Juntos Center for Advancing Latino Health at KU Medical Center as well. First, we, of course, want to, we're all a little sleepy today. We want to give a congratulations to the Kansas Jayhawks winning the national title just hours ago. As you can imagine, there will be plenty of tired people kind of slugging around at work today, a lot of tired students. The team pulling out a stellar last-minute comeback last night. In case you missed it, this is what it looked like inside the locker room as head coach Bill Self came in to address his team. Come on. All good stuff. I love seeing this morning. A live look at Bourbon Street now in New Orleans. Let's take a peek at that real quick. Things are, I think, calming down. Yeah, it's dead there. Okay, not quite the scene. Not quite the scene a few hours ago, but very, very cool. Fans hit Bourbon Street right after the big win, though. A lot of blue outside those bars, the right kind of blue. Photos were taken by EarthCam around midnight. Celebrations from Lawrence. We're going to show those coming up a little bit later on in the show. So get your questions sent in to us on YouTube, Facebook, and the Medical News Network. You can find links to all of those right there on your screen. And let's head over to a tired Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, joining us with numbers. And did you get some rest last night?
Yeah, I did. It was hard to sleep, but
you turned it off a little bit and then come back, and it was all good stuff.
Yeah,
it was good.
It was good. So happy for Coach Self and the team for sure. Right now in the hospital, we have 10 active infections, 1 in the ICU, 0 on the ventilator, still 34 in that recovery period as well. So our active infections numbers continue to go down again, which is a good thing. So far, again, across the nation, haven't seen any increase or uptick in case numbers. I think there are a little bit uptick in the Northeast, but we're keeping our eye on that as well.
All right. It was kind of a long day for you yesterday because before you went home to watch the game, you spoke last night to several current and retired NFL players and some folks in the community last night about the virus and the vaccines. Tell us a little bit about what you guys discussed. What was that all about?
You know, it was a great program put on by the NFL alumni and the Kansas City chapter. Just really good, informative. There were questions by the former players. We had some community questions. I think it is one more way that we can continue to get out the accurate message about, truly thoughtful questions about what's going on with the virus. And most importantly, this was really directed towards vaccination and really helping people to understand that vaccination, number one, is safe. These have been proven safe. Even though we heard about some of those early adverse events, we've had so many more doses of vaccine given since those early days, and we still haven't heard any increase in any of those adverse events at all. In fact, there was an article recently published saying that even if you had an anaphylactic reaction to the first dose, people who got the second dose, having had that anaphylactic reaction with the first, they did not really have a high risk for having that with the second as well. So it is turning out to be a very safe vaccine. In addition, we know the benefits are multifaceted. Number one, helping reduce hospitalization, severe disease, and death. And we know that it has continued to do it even throughout the variants. Two, also helping reduce that risk of long haul, which is vitally important for people of all ages, because we know the quality of life that is brought down with people who have long haul syndrome, whether it's brain fog or shortness of breath or not being able to taste or smell. So it was a great informative town hall, and we really hope to do that again.
Yeah, people still have questions, so you're there to answer them.
Exactly.
Good. All right, let's see if we have any reporter questions on the line today. All right. Moving on, we'll get to community questions here in just a bit. One portion from the National Institutes of Health RADx-UP grant is a study showing that impact of masking among school children during the Delta surge. 72% fewer cases of in-school transmission were reported among students required to wear a face mask. Probably no surprise to our guests this morning. The grant funding also hoped to increase the amount of medical technology available to some economically challenged areas while speeding up mass testing at the same time. So how did the grant perform? Joining us this morning is Dr. Ed Ellerbeck and Dr. Catherine Satterwhite, also Mariana Ramirez joining us to talk more about it. Hello, how are you?
Good morning.
Enjoy that game last night?
I really did.
Okay, you said you stayed up a little late.
A little late.
Glad you made it here.
I got up though.
You're here.
Just to
you
be
made
with
it. Glad you are here in some shape or form. So just remind us a little bit about how and when the grant money started and where it goes from here.
Yeah. So we got to go back all the way to September of 2020, and so this is before the vaccine was available for us. And at that time, we were having huge disparities in the impact. And Dr. Hawkinson can talk about that because he got the firsthand experience in the hospital of all the individuals from our high-risk communities who were hospitalized here with COVID. And so those initial, so we were just very fortunate to get the funding from the NIH to really work with underrepresented, underserved communities to help them address the COVID pandemic. It was really focused on empowering the communities. And so we worked not only in Wyandotte County, as you mentioned before, but we worked with 10 counties across the state of Kansas, the 10 counties most disproportionately affected by COVID, to really work with members of the community at a grassroots level to empower them to help us develop and design response to COVID. And that response started off with trying to improve access to testing. We ended up in these, I think you can see on the visual, the 10 counties that we actually worked in around the state. But we worked with those communities to help them improve access to testing. We had over 500 testing events, almost 50,000 tests actually delivered to underserved communities. And then also work with those communities on communications efforts to try to help them understand when to get tested, how to respond to testing. We specifically addressed issues like masking, social distancing, safe practices. And a lot of those efforts were really designed to try to increase reassurance within the communities about their ability to work with the healthcare system when they actually needed to, and also to combat a fair amount of misinformation in the community. And that's one of the things we really were able to benefit from the underlying message that this program was able to produce to relate to that.
So what was the response from community members?
The community members were anxious to be engaged. They were anxious to actually work with us on developing appropriate messaging. And in fact, that grassroots effort, we actually work with local. First off, we work with organizations within those 10 counties. So we work with public health departments, community health centers, faith-based organizations. We actually help them link up and form what we called LHEACH, or Local Health Equity Action Teams, to actually work with them in partnership to make sure we had that representation and the voice of the local community. And they were, I think, very excited to work with us, in part because they felt the need to actually have the referent authority of the CDC, KU Medical Center, in helping them address a lot of the misinformation that was going on in those communities. That community-based effort is winding down in RADx-UP. I should also say what RADx-UP stands for Rapid Assessment of Diagnostics in Underserved Populations. That funding's tapering down now. But that model that we actually developed now was very well received at the local and national level. And now the Kansas Department of Health and Environment, with funding from the Center for Disease Control, is now working with us to extend that model of community engagement, empowerment in response to COVID, engagement of community health workers now in 20 counties across the state.
So it's the long-term effects that you're seeing from this one big fund.
Right. So 2 more years of funding for that. And we're really trying trying to look at ways to, we know COVID's going to be around with us
Sure.
forever, but we're also looking at the infrastructure that we need to respond to the endemic stage of COVID's now, address miscommunications about vaccinations in general, and basically have the infrastructure where we're in a better position to respond to pandemics like this in the future.
So Dr. Satterwhite, jump in here with us. Explain to folks exactly what you do, how you're reaching communities. And with what Dr. Ellerbeck has explained, are you seeing those effects overall? What do you see when something like this comes to the table?
So in my role, I work for the Department of Health and Human Services, and I do a lot of different things in the public health arena. And actually, I want to share one of the things that popped into my head when Dr. Ellerbeck was speaking was the periphery benefits of this enormously successful project that he conducted with his team. One of the things that we've also learned and continue to learn more about in terms of the impact of the pandemic is the importance of social connectedness. And by bringing all these partners to the table for a shared good, it not only addressed a lot of the immediate COVID concerns, but it created a place for community to grow and for people to connect. In fact, one thing we're hearing, and Dr. Hawkinson talks a lot about new data that has come out. Adolescents were extremely impacted by the pandemic, as well as a lot of other groups, including the elderly. But one of the biggest things is when you can connect to people, everything else gets better. So that's something that I think about a lot, is what goes around the experience that we've had the past 2 years, and how can we build on it.
That makes sense. I want to bring in Mariana. Tell us a little bit about what Juntos does and how this grant has impacted minority and the Latino community.
Sure, thank you, and good morning. So Juntos focuses on improving the health of Latinos in Kansas and beyond. And we do that through a lot of community service, research, and education. So we link researchers in the medical center with Latino communities, and also link Latino communities with opportunities to participate in research. And we're still working with the team in RADx-UP, particularly in the communications, and to make sure that we were supporting those communities to address misinformation. There was tons of misinformation anywhere, and make sure that they got access to reliable information. You might remember at the beginning of the pandemic, if you went to the CDC website, you could see current information in English, but the information in Spanish was lagging like a month. So for us, it was really important that reliable information, current information was available to our communities. So we partner with 6 counties in the RADx-UP project: Wyandotte, Johnson, Sedgwick, Seward, Finney, and Lyon, to develop a community health worker campaign. So community health workers are trusted members of the communities they serve, and they connect them with health resources. So early on, they were the ones helping parents who had lost their home. They were helping people who didn't have food on the table during the pandemic. And we partner with them to develop message, to address misinformation, to share lived experiences of their clients, and then encourage vaccination, testing, masking. And we did that in 7 different languages across the state.
Fantastic. What has been the result that you've heard? I mean, from what you were hearing, a year ago to now, when it comes to accessibility and the misinformation, just what are you hearing in those communities, and how have we moved the needle for those folks?
But thanks for asking that question. We also work with KDHE to do focus groups across the state to understand what was the hesitancy among Latinos towards the vaccine. And we had a lot of fear and misinformation about infertility, for example, and from parents, a lot of fear that the vaccine might have worse consequences of their health of their children in the long term, and less of seeing the benefit of the vaccine itself. So we work with KDHE and 2 marketing agencies to develop a communications campaign tailored to those things that we were hearing. It was called Por los Nuestros, that means for our people in Spanish. And we developed PSAs with testimonials from people, also from health professionals, addressing these topics. And what we've been hearing from the community is that connecting them in a way that makes sense to them in their language has made a difference. And we've received very nice comments from people saying, I wasn't sure, but then I listened to it and I got vaccinated. I got my children vaccinated. So we've been getting a really good response.
Great feedback. Thank you for telling us about that, because I want to turn to both of our guests here. When you see someone like Mariana, taking that money and putting it out in the community, and then we see those responses, and people have gone from having concerns and questions to now going and getting vaccinated and getting their children vaccinated. What is that like for you, and what is that saying about our community and where we stand?
We just have to give a shout out for all the members of our community who've stepped up and worked in this effort, who've partnered with us and with others, partnered with Mariana on the communications efforts, and helped to take that message back to their churches, to their schools, et cetera. It just makes you feel really good. And the work that Mariana and her team have done at Juntos is just absolutely amazing. It's a national model for community engagement. I was actually privileged to be able to work with her on a recent episode of what she calls Juntos Radio. And we were actually able to start talking about things like colorectal cancer screening, because it's Colorectal Cancer Awareness Month. And so we wanted to actually address some of the preventive health care issues that have been neglected over the last 2 years during the pandemic. And so she's carrying that message out too, and just got an absolutely wonderful communications vehicle.
Well, and it's not just giving the information, but I think you've touched on it, it's the empowerment, and then connecting with those folks who then, like you said, go back into their communities and their place of work and their churches and schools, right, Dr. Satterwhite?
Absolutely. It's those one-on-one conversations. We've seen it repeatedly throughout COVID, but even well before, that when you have the opportunity to talk to someone who can answer your questions and can create a very personalized message for you, it makes a difference. So Mariana, awesome. Congratulations, and please give an air hug to all of your community health workers who have boots on the ground, which makes a big difference. And I do just want to also give a shout out to a lot of our local public health family, which includes all sorts of different types of people, from the neighbor next door all the way to the local health department and beyond. It's Public Health Week. And so if you get a chance, thank those people who have played such an important role in everyone's lives over the past 2 years.
Dr. Satterwhite, let's talk a little bit about the theme for National Minority Health Month, Awareness Month. Talk to us a little bit about that.
So it is April is also, in addition to being colorectal cancer. What's the awareness?
I actually think it was March. I got my months.
It is, but that's all right.
Time just moves on.
No, it's
but
all good.
It's always time
always
to do your
something.
colorectal cancer awareness.
Always.
Sorry about that.
No, it's okay. It's okay. Well, April is National Minority Health Month, and this year's theme is give your community a boost. And it's actually really tailored to encouraging people to get their COVID-19 booster and to get up to date on their vaccination, something I know that is oftentimes covered on this program. But more than that, it's about trying to take this moment we have right now. Cases are low, we're in a pretty good place, but let's prepare. Let's lay the groundwork in case something happens again, so that we're in a better position for next time. So the U.S. government, through the Office of Minority Health, has created a bunch of toolkits that really recognize the role that all sorts of different communities play in promoting something like COVID-19 boosters. There's community-based organizations, there's parents, there's schools, there's information for high school and college students, for older adults, for faith-based leaders, for rural communities, you name it. It's really a recognition that everybody has an opportunity to help, and that it's important to have those resources be available and customized to facilitate those one-on-one conversations that we know are so important.
Mariana, I know you have to jump off here in just a few moments, so I just want to get to some community folks that we spoke to really quick. Immigrants and U.S.-born Latinos account for more than 1/3 of people without health insurance in the Kansas City area's 3 counties, largest counties. That's one of the findings in a study by Reach Healthcare Foundation. So we spoke with some folks who explained the impact of underserved communities.
Maybe that's the reason why if I have the possibility to go back home and get it taken care of, it's probably way cheaper to go to Mexico and get it done.
And the time frame too, like
yes,
if you were to make an appointment, it's typically 3 months out or 6 months out.
I do know a few people that are not on commercial health care, and so the care that they get from the state, they have to wait a long time for an appointment, no matter what your issue is, and no matter if the doctor or the facility already know what your concern or issue is. It could take a month or even longer than a month just to get an appointment.
And that could be really frustrating for people. You know, people just saying it's just too much. The accessibility isn't there. Just what's your response when you hear the community speak?
It's documented. They're right, and unfortunately, there are systemic changes that need to occur to really address the inequities that we see in the system. There's both a role for systemic change and for self-advocacy, but I think what we lose a lot sometimes is hoping that people will take it into their own hands when we need to be partnering to make bigger changes, to increase accessibility, to meet people where they are. There are some excellent community health centers that are located in neighborhoods that are traditionally underserved, but they can't do it all.
And I mean, not all healthcare issues are not created equal, Dr. Ellerbeck. So just what are your thoughts when you hear the community speak and talk about their specific issues and things that might keep them away from getting the right healthcare?
It's very frustrating. So I think that there is work in our communities like Wyandotte County. We have access. We have some support through Vibrant, Duchesne, Swope Health Services, and others that are actually doing some incredible work. But it's not enough, and access still remains a huge problem. And lack of insurance really prevents people from actually finding a doctor, having a regular source of health care, which was one of the big issues that we addressed in the RADx-UP project. If you don't have a regular provider that you trust, where do you go for your testing or your vaccinations? So it's tough. I mean, they've made some recent changes on the Missouri side, which might change access. In Kansas, it's tough.
It's tough. Mariana, I know you have to go, but I just want to give you a chance to share a final thought to our audience before you go.
Well, similarly, right? I think we have to work together with the wisdom of communities, but also the resources from the system to make changes that are sustainable. We are recently doing some interviews to identify barriers for kidney transplantation, because there is a disparate use of kidney transplantation for Latinos. And we're finding that definitely health insurance and immigration status are huge barriers. And for somebody who's a mom, who's a wife, to have the only way to have access to dialysis is through ER, it's not fair. We can do better than that. And that's just an example. That is just an example. But especially for specialty care in our area, we really need to work together. Wyandotte Care, MetroCare, they do a fantastic job coordinating, donated care to address some of those gaps, but we need to do better. So I think it's a standing invitation for healthcare systems and community members to work together and address that. And a big shout out to all of our community clinics, Vibrant, Duchesne, Soap, Mercy, and Health. They do a fantastic job.
Mariana, you and your team are doing fantastic work, and you're just a great community partner. We appreciate you very much. Thank you for being with us. Come back anytime.
Thank you.
Thank you. All right, then there were two. Okay, so Dr. Satterwhite, tell me, we were talking about National Minority Health Month. Also, Black Maternal Health Week is coming up. Tell us why this is such an important topic to focus on.
So Black Maternal Health Week is something that has been, I think it's the 5th year that this week has occurred. And it's really about recognizing that we need care that centers Black mothers, that is really all about them. So we know that there are tremendous inequities and disparities in maternal mortality. and in birth outcomes when we look at Black women versus white women, or even some other racial and ethnic minorities, that Black women are more likely to die. They're more likely to have, as a result of childbirth. And actually, I do want to highlight one other thing that I think is particularly timely. So as we're starting to see some of the adjustment and the rollback of some of the emergency response that we put in to really address COVID-19, some of that has to do with insurance. And one of the things that was what we were able to do through the COVID-19 pandemic is actually extend Medicaid service to cover the postpartum period for a year, which actually was an important step to addressing some of that inequity, because we know that there's a lot of health outcomes that occur in a relatively short period after birth, and that's something that the administration did just announce that is going to be an option still for states to opt into, even moving forward, at least for the short term. So it's really cool to think about things like that as an outcome of COVID that are addressing a really long term problem that we've had with maternal mortality and inequities.
And let's talk about vaccines, because as we start to pull back on COVID, and a lot of things have been missed during this last couple of years. That was something that you were concerned about, Dr. Satterwhite. Can you talk a little bit about what you're hearing as far as are we missing something? Have we been missing any vaccines over the last couple of years?
Yes. So one thing Dr. Ellerbeck mentioned, and Mariana did too, that their project really also addressed misinformation. And we've got a long ways to go with that. We know that is not over, and that misinformation has spread to be beyond the COVID-19 vaccine realm, so that we have seen lower uptake of routinely recommended vaccinations. In particular, I think things like the HPV vaccine, that we sort of were struggling to get a really entrenched uptake anyway. So that, for those of you who don't know, that's recommended for boys and girls aged 11 to 12, but you can get it at much older ages too. But we really want people to get their vaccines on time, because there's a reason we recommend them then, and that's to prevent the most outcomes that those vaccines can directly address. But the COVID-19 vaccine misinformation in particular has had a tremendous impact on vaccinations across the board.
Let's get to a couple of community questions. Dr. Ellerbeck, Joellen has one, and I'll start with you on this, but what achievable goal, say within the next 3 months, would you like to see?
Achievable goals in the next few months. I think our goals are more long term. I mean, we really are trying to, well, actually in the next 3 months, we are actually in the process of working with KDHE and the CDC for onboarding community health workers within those 20 counties, and getting them supported with linkages to healthcare providers and public health departments, connecting them with communications infrastructure to start tackling not only COVID preparedness, but also other healthcare access issues in the community.
Dr. Satterwhite, same question. Achievable goals in the foreseeable future?
Really concretely, to get more people up to date on their vaccines. I really think we have to take advantage of this time right now to be better prepared, just like Dr. Ellerbeck said. And one of the most concrete ways, Dr. Hawkinson says that time and time again, our number one tool is vaccination and keeping people safe from COVID-19. And then I would also like to throw in there and getting up to date on other preventive actions like vaccines, like mammograms, like colorectal cancer screenings. There's a whole bunch of things that we know are lagging right now.
So Dr. Ellerbeck, just before we get to our final thoughts, just how would you rate the success of the grant today? What lies ahead? You kind of touched on it earlier about what's lying ahead over the next months.
Well, that's really tough, because we're always looking at it as the glass half full or half empty. I think we can say how proud we are of some of the accomplishments. We're so proud of the work that we've done in the community. And then we see how much still needs to be done. How many people still haven't gotten vaccinated? How many people still don't have routine access to health care? And so I would echo what Dr. Satterwhite said. We just have so much work ahead of us to keep working on to try to get those vaccines in place. Because COVID's going to be around with us for a while. We need to get the rest of the community vaccinated and prepared so that we're not inundated with the next wave.
Dr. Hawkinson, I'm just going to squeeze a couple of quick COVID questions in for you. Janet wants to know, do immunocompromised patients need a fifth shot 4 months after their fourth shot, since the CDC is suggesting another booster after 50?
Yeah, I think that was buried in there as well. They are talking about for immunocompromised people, if you've been up to date and gotten your fourth shot. And again, the fourth shot is that booster because really the first three are the primary series, with that fourth being the booster, and then it is recommended for that fifth dose at least 4 months after that fourth dose. So there is that recommendation there.
All right, Fanny wants to know, there's been a stomach flu going on. She's not been feeling well, vomiting, fatigue, backache. She had this a few days ago. But she wants to know, might this be COVID? She has to work today and wants she wants you to know she should take a sick day.
Right. We know there are other viruses going around, respiratory viruses, but also gastrointestinal or GI viruses as well. More than likely, if you knew other people who had it, say in the household, and you're fairly certain that's what it is, that's probably what it is. But really the only way to really understand and know is to do the testing. And certainly if you have testing supplies at home, it's easy to do that antigen test. But again, that is the only way to really fully know. And I think the important thing is, just because it sounds like you're being thoughtful and don't want to go to work if you think you may infect others. But really the only way to fully know, and we can draw inferences from, again, your symptoms, are other people around you sick, but the only way to really know and be sure is to do that testing.
And you don't think it's the KU game that kept her up last night? Maybe that's why she's sleepy, right? Yeah. Okay.
But you don't want people with viral gastroenteritis coming into
no.
work.
COVID or stomach bugs. Stay away.
The good rule is, and certainly we've had this at the health system forever, if you are ill, don't come to work.
Yeah, it's okay.
I think it's hard, and nobody wants to miss work and take a sick day, but you are also putting others at risk as well.
All right, let's get to some final thoughts. While I have you both here, just give us some thoughts about what we should know, where we're heading to, what all the rest of us can do. Just your final words.
Yeah, my final words is I just, again, want to give a big shout out for all of the community members who partnered with us and have just been working countless hours to address the COVID epidemic, to support testing and vaccinations and communications efforts in their communities, and give them a big air hug, as Dr. Satterwhite mentioned, because we still need their help and support moving forward. There's still work left to do.
Dr. Satterwhite.
I have one thing to mention. As we move forward, I want everybody to just remember their own mental health. It's spring. If you can get outside, enjoy the sunshine. It's something that I think we are on a very long journey with the collective mental health of the nation, of the world. And it's important to recognize that you were part of that and take care of yourself, but also just be there for other people too.
Oh, I like that. Dr. Hawkinson.
Just echo all that. I think it's important, and again, having to do the NFL alumni town hall yesterday about vaccination, just continue to encourage people to get vaccinated, be up to date with your vaccination. We know certain populations, whether it's elderly, whether it's minority populations, have been hit extremely hard through COVID, through the pandemic. We want to keep everybody safe. That serves better for everybody, for you, for your loved ones. Please continue to get that message out there to vaccinate. We know they're safe, and we know they continue to be effective, even against all the variants that we've identified so far.
Thank you both for being with us today. We appreciate it and appreciate all you're doing for folks in the community, so thank you. In medical headlines this morning, looking to lower your risk of heart disease, researchers say eat an avocado. Alexis Del Cid, who covers our cardiovascular beat, talked with Dr. Shannon Hoos-Thompson, a cardiologist here at the health system.
So does that mean avocado is the magic fruit that's going to completely lower your risks of heart disease?
No, it doesn't mean that you have to be consuming lots of avocado.
So what does it mean? Where's the hole in this study?
So there's not really a hole. You just have to keep it in perspective.
Okay.
So are avocados a heart-healthy food? Yeah. But really what we know from this data is, one, it was from surveys that we've been collecting for almost 50 years, starting about the 1970s, in nurses as well as other health professionals from the men's side. And they basically just used that survey data to then find this data, find this information. And basically what it talked about more importantly is that, oh, by the way, these people who are consuming more avocado are consuming less processed meat, less saturated fats. And so just overall, we're consuming a more healthy diet and a less unhealthy diet. So it's more that balance. And so as when you plug in the specific variable, in this case, avocados, yes, that matters, but does it have to be avocados? No, it comes back to those two things.
So people who are eating 2 servings of avocado tended to have a healthier diet in general.
Absolutely.
Healthier in other ways. So it's not like you can eat bowls and bowls of Cheetos and then have 2 servings of avocado and it erases the Cheetos.
No, dipping your Cheetos in avocado doesn't help make your benefit better. It means you have to make a committed or a focused effort at, yes, knowing what a heart healthy food is, a cardiovascular healthy food is versus what isn't one. And it has to be a sustained and just a way of living, way of eating.
One more question for you. What is a serving of avocado? Because I would just assume that 1 avocado is 1 serving.
Yeah, and that can kind of vary, but I would say in general about a tablespoon.
Ooh. I do a lot more than that.
I had an avocado for dinner last night.
I know. Okay, good to know. Good to know. Good information. All right, a live look right now. All those sleeping Jayhawks there at the KU campus in Lawrence right now. This is thanks to our folks and our friends over at KSNT TV. So, yeah, there may be a few thousand students missing class today after that big win last night. The campus, for the most part, quite quiet this morning as students and fans continue to celebrate that national title win. And, of course, crew's wasting no time making a big change. Are we going to see that sign inside Allen Fieldhouse? I think they already added the 2022 sign, proudly saying that the Jayhawks are the national champions. You can see previous years of KU, they have taken the title. And here, Dr. Hawkinson, I know, you need to get a new figurine. This is his little figurine. You need a new bobblehead because it says it's 52, 88, and 08. So we will get you. Okay. We will get you a new one coming. That one just will not do anymore.
No.
All right. Well, as the Jayhawks got their much-deserved national title trophy in New Orleans, this was the scene in Mass Street last night over in Lawrence. This came from the Lawrence Police Department, shared some videos last night on Twitter. So we caught some of those, and no surprise, people very excited. And there's even this new tradition, the crowd surfing shopping cart. We have no idea what this is about, but it looks totally dangerous and I guess fun. All the kids are doing it these days, apparently. Have you heard of this, Hawk?
No, I'm sure it was made up by
someone like
adolescent
you.
men.
Someone very immature. Sounds like something you and your friends might have done.
From about 12 to 30, that's kind of what happens.
Right. Okay. All right, let's talk baseball. This Thursday, the Royals home opener. Yes, we'll be out there. And we know a lot of you have memories, your favorite Royals memories, and we want you to share those with us. So right there on your screen is a QR code in which you can email us. You can share your photos and your stories, email them also to the Medical News Network. You're going to use the address right there on your screen. So share them with us, send your pictures, and we would love to share those right here on air when we are live out at the K on the home opener on Thursday. So go Royals. Very exciting. And thank you so much for being with us today. Don't forget you can catch our show anytime on Facebook, on YouTube, and on Twitter. Before we go, we want to share this video showing the emotion on the court after the big Jayhawk victory last night. KU Hoops produced this video, and it is a great way to start your day. Have a great morning.
Thousands will soon be getting their second COVID-19 booster shot. So what's the holdup with the thousands choosing to hold off or not get the vaccines at all? Whether it's misinformation or other concerns, we'll show you the science.
Subscribe to our morning medical update and open mics with Dr. Stites podcast. Now, everywhere podcasts are available.